This is the Kratom Science Journal Club with Dr. Jonathan Cachat, neuroscientist and expert in psychopharmacology. In each episode, we discuss an article in a peer-reviewed journal. I'm your host, Brian Gallagher, blog and social media writer for KratomScience.com, your source for all things Kratom. So we're looking at a case report of Kratom-Induced Psychosis from Curious. I guess it's a web journal. And this was published in June of 2021. And this is a team from West Virginia School of Medicine, Department of Psychiatry. And I think, as far as I could tell, it's like a team of medical students that did this. Psychiatry, West Virginia University School of Medicine in Martinsburg, West Virginia. It's a guy that shows up at the ER with some symptoms of psychosis. He's a 43-year-old white male with a history of post-traumatic stress disorder, traumatic brain injury, and chronic primary adrenal insufficiency. And he shows up at the ER. He hasn't slept. He presents with psychosis and insomnia, considered secondary to acute kratom intoxication, whatever that means, really. And he
hasn't slept in 7 days.
5 or 7 days by the time he showed up to the hospital. I think his symptoms started after 5 days of no sleep, which, yeah. So why isn't... I guess we'll get to that first. Like, why isn't this considered sleep psychosis? Because I looked up all of his other symptoms and stuff that he's gone through with psychosis. Just I didn't look at the studies, but I just did a PubMed search. If you put in PTSD psychosis, you get 1,118 results. If you put traumatic brain injury psychosis, you get 265 results. If you put in primary adrenal insufficiency, you get 38 results. And insomnia and psychosis, you get 722 results.
This is in PubMed?
Yeah, these are all PubMed searches for each of his other symptoms. So that's basically the question is, I mean, he has all these other things, and they kind of ruled him out later, but to me, it's like whatever induced the lack of sleep is probably what caused the onset of psychotic symptoms.
Especially the hallucinations. I mean, I've been up for 2 days or 3 days, and I'm starting to see people in trees and hear things. Up for 7 days, I can't imagine the auditory and visual hallucinations that you would go through just solely because you haven't slept. Your nervous system, I think it's coming out. It's been out for the past couple of years. People talk about it, but essentially, sleep is one of the most important things for the health of your nervous system. Full stop. Period. That's the deal. Mm-hmm. But yeah. I think before I've read papers like this before, and we're on the Kratom Science podcast, and everybody knows generally how we come at things, and I try my best, especially with these papers, to go in them agnostic. I don't want to go into it looking for problems. I want to just take it at face value, what they've put out, which is how I went into this one. But, it's not how I ended up. That's for sure.
So it says his presentation was suspicious for bipolar type 1, severe agitation, and prompted the VA to give him haloperidol and I'm not even going to try to pronounce that word, but it's basically Benadryl. Yeah. I'm not sure. Why would they give... Do you know why would they give him Benadryl? Maybe just in case he was having some kind of allergic reaction to something?
I think just to try to calm him down without giving him benzos. The haprodiol is an antipsychotic. I think that out of necessity, you just sort of have to, start with stuff that wouldn't potentially cause another problem. And I think if you present in the ER and you're sort of delusional, so you'll get the hyperdiol, but then I think they maybe want to see if they can get him to sleep or calm down, but they don't have labs back. They don't know what else could possibly be in his system. So going with the antihistamine is just sort of a safe. Is he have an allergic reaction? Yes. So it would cover that. But it would also presumably induce some sort of sedation or a nudge in the direction of sedation. And so maybe that's what they were thinking.
Yeah, and this guy he was also on medications that he had recently quit, I guess after he started using Kratom. And he did 6 tours of duty in the Army, and he had several head injuries, but no prior symptoms from the head injuries. And he had low energy. That was from his adrenal disorder, which is what he was taking the Kratom for. And his typical dose of Kratom was 6 to 8 pills a day. So I looked at the one site that sells, I don't usually do capsules, but they're either 600 or 800 milligram capsules. So 8 would be 6.4 grams a day, which is not excessive at all. Even if he was lowballing them, even 2 or 3 times that wouldn't be that excessive. And then they said during the final week he switched to a liquid extract bottle, which is probably one of those OPMS shots. And it said he consumed the entire bottle of liquid in a week, in that final week where he started to not sleep. However, that would only be a few drops a day.
He took it all at once.
Okay.
So it was a week prior to his admission.
Oh, okay.
Yeah. So I'll let you wrap up, but then I'll give you my sort of like in between the lines on who I think this guy is.
So he took the bottle, and he said he noted increased energy and was able to continue his daily activities without fatigue. As a result, he did not feel compelled to take his medications. So he was on Cymbalta, hydrocortisone for hormone, and he had testosterone weekly intramuscular injection, and they had him on 5 milligrams of Adderall per day for energy. Right. So just stopping all of that, which is Cymbalta's an antidepressant, hydrocortisone is hormone, testosterone, Adderall, that is going to screw you up just cold turkey and all that stuff. I would think it would at least affect your sleep patterns.
For sure. I think that I understand where these, I don't know if they're med students or not. We don't have MDs at the end of the name. So let's say where these students are coming from and doctors have a tough job, and one of their jobs is to do no harm. Right. And so you have to consider as many factors as you can, and then make an informed decision based on what your factors were. And so I think that in the minds of these doctors, if they were true and coming out of good faith, and I think, we could have a good faith, bad faith discussion towards the end, but if they determine in their heads that him taking the Kratom directly resulted in him stopping all these meds, and because he stopped the meds, he didn't go to sleep, then I think that's the only sort of rationalization that you can make to say this is Kratom-induced psychosis. But still, then it's even weirder because the Kratom didn't induce the psychosis. The Kratom induced a feeling where he stopped taking his meds and then he didn't go to sleep, and those two things caused the psychosis. And so a nuanced difference, but that's not what the title of their paper says. The title of the paper is A Case Report of Kratom-Induced Psychosis, not a case report of a guy who was up for a week because he stopped taking his meds because he felt good because he was on Kratom. And so, in our world of headlines and, only reading the Facebook thumbnails, the title from this report is a lot different than what is explicitly stated. And the case that I made here too, if they never really said because the kratom caused the stopping of the medication and presumably the sleep, therefore we think it's kratom. They never said that. They keep it like, they keep it a lot tighter than that. But so, I just, that was one of the things that really bothered me, is like, cause I read a sentence that essentially said like, let's see, it was basically like, and he was feeling really bad, for a couple of days because of, and I thought it was literally in my head, I read because he didn't sleep, and then it said because the kratom, and I was like, wait a second here.
Yeah, I mean, even the one part, it says, it noted his complex medical history. For this reason, it's necessary to delineate the effects of kratom from other potential sources of psychosis. The timing of symptom onset implies the significance of substance or medication use in his psychosis rather than an exacerbation of his underlying PTSD. It was therefore determined that his confusion and hallucinations originated from his extended period of insomnia. So then why isn't the paper called A Case Reported of Insomnia-Induced Psychosis then?
Yeah, and why is that such that clear statement that we all were assuming at the top on the third page of a 3-page text paper, like in the second to last paragraph is where they say it was therefore determined that his confusion and hallucinations originated from his extended period of insomnia. And it's just, like I said, I try to go in without prejudging, but when you start seeing these things mount up, you're like, what was their motivation in writing this? Because they didn't say that anywhere in the beginning. It clearly doesn't say that in the title, but it does. They do sort of admit these things at the end and the conclusion. And it's just like, why? Why would you do that?
Yeah, I mean, I wonder if it's just because kratom is a good headline. Maybe more people will pay attention to it. I don't know. I'm not sure.
Yeah, and so that would also be sort of like an agnostic thing on their end. Okay, so in that case, they're going for clout. They want to write a paper because kratom is interesting and kratom will get headlines, or they want to study it because it's new and it's interesting. But you would assume that they wouldn't brush over, and they didn't. Maybe I'm just getting too amped up because of this. I was thinking about all this stuff. But when I just see it pile up, it drives me wild. But like most of their stuff about kratom it's potentially harmful. We don't know anything. This guy came into our ER and was psychotic because of kratom. Like that's essentially what they're saying. And of course, it's more nuanced. They did say like, mitragynine didn't show abuse potential. So they're highlighting some things that say like, okay, it could be people use it for opiate use reduction. Of note, an opiate reduction was used. But I still think they're very skeptical. And they're saying like without FDA approval, the fact that it's on the DEA list and the fact that this guy, it's very safe for the doctors to say that kratom caused this psychosis. And it's not a paper if you say that it was because of insomnia and because he stopped his meds. No duh. So, yeah. Then my other thing in my mind was just like, maybe this was an assignment where they had to write a case, they had to write up some interesting case, and they're just go-getters and they wanted to get it published, to get a citation. It's an open source article. I looked into it a little bit. It's an open source journal. They do have peer review. It was peer reviewed within, let's say 25 days or something from when it was submitted. And
there's a couple monitoring editors who are MDs, I think.
Yeah. And so I don't know. Maybe I should take a few good breaths and just calm down a little bit.
It says, the one thing I just read about insomnia, confusion and hallucinations originated from insomnia, but the other part says, after speaking with the patient, kratom was considered the most likely cause of acute psychosis. And another thing, did they test the kratom? Of course not. And they did give him a blood test. And the whole thing was, he said the onset of the psychosis came on and the insomnia came on before he stopped his meds, I think. Or his meds had never given him problems like that before, so that's something to consider. But I think the fact that he stopped them abruptly while taking this new thing, didn't help.
You're right. So I think the conversation that we're having right now is essentially the conversation that happened in the doctor's office, right? Mm-hmm. And it's not hard, and you can't blame them, but it's like, okay, so you did this, and this happened, that probably wasn't a good idea doing that. Like, if you start the story out with, this is what I did, and then everything else fell from it, I stopped taking my meds and I didn't sleep after I took this kratom extract, which I did for the first time. It's very easy, it's very safe to say, well, probably shouldn't have taken that kratom, huh? That social interaction and that valid advice and maybe you shouldn't have done that is one thing socially, but to publish it in a paper, almost like making physiological or biological medical claims, those are different from the sort of social milieu, the social contact. You know what I'm saying? It's easy to say XYZ, shouldn't have taken the kratom, sorry, bud. And the patient to very easily go yeah, that was probably not a good idea. But that doesn't mean that kratom-induced psychosis by any means.
I don't understand how they call it kratom-induced psychosis. Why don't they say possible kratom-induced psychosis possibly induced by kratom, at least like that, or
yeah. Their last sentence says, we present a case of manic psychosis, which is considered to be associated with kratom. So if that word associated was even in the title, it would be it would make me a lot less skeptical on sort of the intents here. It's very real. They could have pure intents and good faith. They could not. You could think of it the other way. Okay, well, someone asked them to get a report in here. No matter the origination and the intent of the authors, these reports are used by politicians and media to enact drug regulations, no doubt. And if you think that the medical people aren't reading it or are only reading the title, you best believe that the news reports and the journalists, maybe the journalists can be held to a little bit of a higher standard, but the regulators and the politicians are definitely only reading the title. And it doesn't say a case of kratom-associated psychosis. It says kratom-induced, and that's not right.
Yeah, and it's also, there's going to be other papers that reference this for kratom has been known to be contribute to psychosis. I've seen that before. I've done a whole article on hallucinations, and some of the references go back to a good study done by one of Dr. McCurdy, the kratom expert's earlier studies that he also did on salvia divinorum. So it was kratom, salvia, and the paper just had the word hallucinations and kratom in it, but he wasn't referring to the kratom. But it was subsequently used in a article that said kratom has said to cause hallucinations, reference this article that just has the two words in it. So
you're right. Yeah, that's
so not even
scientific telephone.
Yeah,
for sure. And so it always happens that way. I think there's some PhD comics that essentially say the first paper was might, should, probably, should be more looked into, and 3 references down the line, it's 100% causes this, thing. It happens all the time. So yeah, I mean, it's good to acknowledge that. It's good to acknowledge that there's not only telephone that gets played with citations, so the game of scientific citations or citations in any journal is always, there's some element of telephone there. And I'm sure you've seen it too, where there'll be a sentence and that will be a sentence considered in the original paper, but overall the conclusion of that paper is shying away from that sentence. And that would be an example of scientific cherry picking, which, everybody's guilty of. It's, science is a human endeavor. And you need to get citations, in your papers to have them pass muster, and you can, with the right Google collection, pull up the papers that are leaning in your direction already. It's up to the authors to try to avoid that confirmation bias. But I think I'm particularly, as I'm talking out loud to all this stuff with you, upset that the peer review editors allowed that literally to say the last sentence, a manic psychosis, which considered to be associated with kratom, to allow the title of the paper to be Kratom-Induced Psychosis. I think that's on them. ultimately.
I mean, it said like this guy went in, he stayed overnight, and apparently he got sleep because he was normal the next day. I think, maybe
Right.
the Benadryl put him to sleep, and they said he was completely normal. He knew what was going on. That's really what he needed was sleep. I mean, if it was kratom, if the kratom caused the psychosis and he was like actively psychotic 24 hours before, you'd think, maybe that was enough to get it out of his system. But
Well, I don't know if we know of any drug that causes psychosis after ingestion and then is still there a week later causing psychosis. It's unheard of.
major depressive disorder was also considered, but onset of ingestion implies some role of kratom, and the patient did not have a history of psychosis. A timeline provided by the patient indicated the onset of the psychosis prior to not taking his medications.
He's a vet. He's been over there a million times. He's got TBI, from explosions. It sounds like they weren't too serious, but multiple blasts to the head. He's got hormonal and adrenal imbalances and has presented for depression in the past at the VA. So it's kind of unfortunately, just the case that this is probably a good example or prototype of many of our soldiers who gone over there, come back, and go to the VA. So they put him on the antidepressants. It said that his family left to go on vacation, so he was solo. I think he tried to he took the kratom extract and felt so good from it that he stayed up. He probably felt, he's taking 5 milligrams of Adderall. So, I mean, it's comparable to, I think, people who are first taking that to that sort of dopaminergically fueled lack of pain and euphoria, busy energy, motivation to work. And so then he likes that, falls into it, stays up. 2 days later, he doesn't take his meds. 3 days later, he still hasn't gone to bed. Now a result of because of the stopping the meds, and then shows up and presents a very XYZ sequential story about where it started and now where it's ending. It's like I said, it's very safe. But I mean, that's in my mind, that's sort of what this guy, my picture of this guy, and it's between the lines, and I, of course, could be wrong, but it just seems like he is very typical. He's coming in telling a story that's very easy to agree with and follow, and then that's the treatment line that he fell down.
Yeah, and another thing I was thinking about is, could he have taken, got a hold of some meth and just lied about it? I think he was probably tested for other substances. I think they did do a blood test, but
yeah, I think a diagnosis of psychosis without a chemical screen, I think, is almost medical malpractice. Yeah, you can't. But that's
the thing. I wish they would have, maybe tested the stuff he was taking, just to be more thorough. And I think some of the follow-ups they tried to do, he just didn't participate because he was probably fine. Another thing is steroid-induced psychosis was considered a significant alternative diagnosis, but the long-term stability of this patient on his current dose illustrates the appropriateness of his regimen for treating his specific condition. My mom actually had steroid-induced psychosis. She was on prednisone, and she couldn't sleep for 2-3 weeks and ended up in the psych ward. But it was just a weird reaction to prednisone where she couldn't metabolize it properly. But that's kind of what I was thinking, because he's on a hydrocortisone, and it just seems like, having to be on some kind of a steroid every day and then stopping it abruptly wouldn't be a good that
would be worse than the antidepressant, the Adderall. I don't think there'd be any physiological withdrawal symptoms from that small of a dose of Adderall. But stopping hormonal therapy almost immediately, and then the antidepressants on top. Maybe if the antidepressants were alone and they were stopped, I haven't come across any mechanistic papers or stories in my education. They always want you to gradually come off of antidepressants, but I don't necessarily know why, as opposed to why we do that with chronic opiate users, because we know that there's a physiological downregulation of their receptors. And we know that with many antidepressants, there can be a downregulation of serotonin receptors, just like opiates binding to the receptor all the time and the cell taking them in. That can happen with antidepressants, causing long-term potentiation or activation of a certain receptor and then it coming in. And so people could definitely feel like shite and have psychological stuff associated with that as well. But it's not like you're going to get tremors from alcohol withdrawal or opiate withdrawal and have physiological things that you just can't control. Everybody's different. And I'm all hot and bothered about all this, but I just, I'll go back in my corner, Brian. I'm getting too out of control here.
No, come on. Start ranting. We'll have another half hour.
Yeah, it's just I guess here's why I'm upset. Here's can encapsulate why I'm upset. This was a benign interaction that probably happens a lot. And if it was between the guy and his doctor and they decided between themselves that, hey, the kratom extract probably wasn't a good decision, don't do that again because it could set you down this path. That's maybe not. I mean, that's the sociological, easy and good recommendation from the doctor. Now, if this guy thinks that he is biologically at risk because of kratom, that's not necessarily the case. He could use his hysteria to sort of make people think that, but ultimately it was a psychological decision for this guy in this situation that was relatively benign, right? Mm-hmm. Then the med school students get a hold of it and almost in the abstract, they say the paper discusses the current kratom use trends in the United States. Oh no, this wasn't. Okay, no, I'm sorry. It's in the introduction. This paper seeks to bring attention to this potential mechanism. So they're saying kratom use, this potential mechanism for the induction or exacerbating of psychosis. So that's in the introduction in the first paragraph. And then you go down to their last sentence and they're seem to have admitted, well, it's just sort of associated. We wanted to make it, they seem to be very sort of drug hysteria at the beginning of their paper, sort of have maybe gotten a conscience and did some of the research that on kratom stuff. And the citations they use are, mostly from 2020 onward. There's a few from the early 2010s and there's a wild one from 1983. But it just seems like maybe they had this idea. Let's write up a paper. They get to the part where they're doing the discussion and the explanation of kratom and kratom studies, and they sort of get less confident in what they're saying and present a relatively objective review of the data, trending towards potentially dangerous. It's not like they're driving that part home. So what bothers me is that these papers then get titles like Kratom-Induced Psychosis, and these papers are very much used in drug hysteria to take drugs away from people. And so it goes from a benign sort of okay interaction on the one-to-one to this paper that I still question their sort of objectives going into it, and it seems it changes towards the end to being published now, and it says a case report of kratom-induced psychosis. And this is how rules are made. And this is how rules are made with the appearance of being scientifically based. When you go back in the line of the telephone all the way to the original study, the authors didn't intend that. The authors were not really making a case for that. It's getting spun through the telephone to make social changes when there's no physiological or medical necessity for physiological changes. So I think that's why I get so worked up, because this stuff is used in regulatory conversations, and I've been in those regulatory conversations where the regulators will say something like, "Well, this is a case of kratom-induced psychosis," and you're like, "Okay, I understand why you see that because of the title, but let me try to spend let me spend a 20-minute conversation on the backstory of this paper that I'll try to condense for 2 minutes, just so you understand that this doesn't mean kratom-induced psychosis. What they mean is it was associated with a guy who stayed up for too late and didn't take his meds and then presented psychotic, as would anyone in this scenario, with or without the kratom. But it doesn't matter. It's in the age of fake news, the headline is all that people are taking home, and the headline's already out. let's even say that the journal article, the authors come back and say, hey, we thought the title was a little strong. We want to retract it. It doesn't matter because it's already out and it's already being used and people already read it. Like, true or not, this stuff gets twisted down the line. And I think it's something I have spent like a majority of our professional careers and experience trying to undo the harmful social effects that come from the way that these papers get twisted. And so, I have no ill will towards the article writers. I think that if anyone's to blame, it's the review editors who allowed this title to fly. But I do have, a strong personal motivation and experience against these sort of things happening in aggregate, leading to harmful social effects down the line. And I hate to see it, and I hate fighting it on a daily basis. And so that's why I'm all rambunctious about this one.
I'm trying to get people to read like abstracts at least. I'm like, if you have a high school education, you can read an abstract. You might have to look up a couple words, but that'll inform you better than like a news source. But then you have to go one more level more deeply into that. If this is the only article somebody read about a kratom, they would be like, "Oh, that stuff makes you crazy." It's like PCP.
Yeah. Exactly. And the vaccine skepticism, I think, is a great example of how the same mechanisms at play here, where let's say your uncle got the shot and then 2 weeks later had a heart attack. And so in your mind, it doesn't even matter if it was or wasn't caused by the vaccination. When you tell the story, someone will go, "Oh, do you know anybody that had any bad effects from the vaccine?" "Yes, my uncle had a heart attack 2 weeks later." That's correlation, not causation, but it doesn't matter. And that sentence is out there, and let the telephone game begin. That's exactly how it happens. And let's say all of that is even true at the case level. And let's say that this guy took kratom, who he's been taking it for quite some time, or at least a year now, hasn't had any psychotic episodes, but takes a liquid. Method of administration wouldn't lead to such drastic change in effects, but let's say it did. Let's say he got psychosis from taking this liquid, even though there's no real sort of basis for that, or whatever. I won't qualify it anymore. This is N equals 1. Not enough, not a sufficient threshold to base public health policy on for the entire population. It then becomes a statistics issue. And who's the least interested in hearing about statistical issues? Politicians and the general public. They don't care. Uncle, vaccine, heart attack, all they heard, not changing. That's what they're telling their friends next time they get asked if they know anybody that had harmful vaccine effects. And so, got to nip this stuff in the butt before it gets out there. But it's a great example of how kratom causes psychosis is the same as vaccines causing heart attacks. Telephone and lack of deeping into the medical information on it.
So I was thinking of this other one where this guy had he was taking Wellbutrin and he took kratom and had, I think it was like an eye wobble. They said it was like a optical seizure or whatever they called it. I looked up kratom and seizures because I was looking for that one. I think that's older. It's like 2018, but this one's from 2020, a case of Kratom-Induced Seizures, and the same magazine, Curious, and the same two monitoring editors, Alexander Muacevic, and John R. Adler, the same two guys. So it's called a case of Kratom-Induced Seizures, and
now
it's just another case study.
My blame on the journal and its editors is now, it's like everyone's guilty of the same things, but it's conspiracy theorists. It's like, that was some confirmation bias there. That means what I was saying was even more true. I don't know, but I don't know why. I don't know why titles like this get published. And if it's at the level of the journal or the editors, it's like, did anyone ask them for any recent cases of kratom-induced psychosis that they may have needed in order to justify a change in policy? Because, the WHO got shut off at this angle and then they got shut off at this angle. I don't know. It's conspiracy sort of nonsense. But after after you see this over and over again, it's hard to think otherwise. It's not guilty until proven innocent. It's these in aggregate are causing the problem that we're all fighting against. And, I don't know. So it's unfortunate, but that's what happens.
So this guy was a 27-year-old, psychiatric history, anxiety disorder, ADHD, benzodiazepine, opioid use disorder, and then when he was drinking 3 to 4 8-milliliter bottles of Kratom, I assume extract daily for 1.5 years to self-medicate anxiety after losing health insurance. So he was diagnosed as having a seizure secondary to Kratom use, and his seizure was... He went to smoke outside his house when his brother found him swinging his arm in the air like a catching a bug. He subsequently lost consciousness and started having a witness tonic-clonic seizure.
Well, and just the same article, same editors to me just seems wild. And you know why I say I'm going back on what I was saying about conspiracy theory. Like, if you think that major international multinational corporations are not like going around and gaming the system in order to get decisions that they would like, for example, oil companies with climate change. It's a non-medical example. Then it's naive. To think that they're not doing that is naive. It very could easily have been a situation where they want to get more recent 2021 citations in the public literature in order to justify a new batch of regulatory changes. It happens with cannabis all the time. They reference here in the article that the FDA database is slanted. They say that it was, they look at the overdose database, they provide statistics from it, which is, okay, you're just listing the statistics of things that were bad that are in a flawed database, and then having a sentence afterwards acknowledging that it's flawed, but why would you include it at all if it was a flawed source? So, yeah. Who's to say, Brian? But this stuff keeps coming out. We get people like me got to keep on fighting.
Yeah, and also this other article was like a team of psychiatry students.
Mm-hmm.
And
so it's a school
edited by the same two guys.
Yeah. So this was an assignment that they got. They wanted to do something flashy. Students always, I've been a teacher in these in controlled substance classes. Like, people always want to do what is the new drug or what they think is interesting. It was a while back, it was mushrooms, and it was cannabis, and now it's Kratom and cannabis and mushrooms. They're all there. The journal, and shame on the journal for allowing them to publish it with this title. And like I said, we can write an email right now that says, hey, this is a misleading article title. And as evidence of that, we just want to include the conclusion from the same paper that said it was associated with Kratom, not like Kratom Induced.
Yeah.
And they could change it. They could publish it on their website with a new citation saying that this was changed after XYZ was brought to light. But it doesn't matter.
Yeah, you can reference the paper that says it's an insomnia-induced psychosis. We would just like to extend an invitation to the folks who worked on this paper, a case reporter, Kratom-Induced Psychosis, advisors, Dr. Muacevic, sorry for mispronouncing that, Dr. Adler, or any of the West Virginia University School of Medicine students to come on and talk about this paper. And if you recognize yourself as the subject of this paper, we would love to talk to you as well. Catch Dr. John at Cachat. Music is Moonrunner by Captain Big Wheel. Kratom Science Journal Club is produced by me, Brian Gallagher, for KratomScience.com. Take care.